It almost seems like the government's making it worse, from my perspective. How do you see it? Am I wrong for saying that?
Oh, the government is absolutely making this 10 times worse than it has to be. There would not be a need for a national shutdown if we didn't have the government interfering with our ability to address this.
Welcome back, beautiful and amazing human beings. This is Okadowski of WeAreChange.org. We have a very special video for you. Today, we have a doctor who is on the front lines against the fight against the coronavirus. He is here with us today. His name is Dr. Kyle Varner, MD. He holds many board certifications in internal medicines. He has worked in many hospitals across this country, and right now he is in Washington State helping, of course, with the effort to fight COVID-19. Doctor, how are you? How's everything going on? And what are you seeing on the front lines?
All right, well, I'm doing very well. I'm holding in, hanging in there. All right, so what's going on the front lines? So let me give you a geographical breakdown of the coronavirus outbreak. I'm here in Washington State, and Washington State is more than just Seattle, but in the Seattle, Everett, Kirkland area is where the major outbreak is right now. I'm in Spokane, Washington, and we are just starting to receive our cases of coronavirus here. It's believed that we have a lot of cases in the community, and we are ramping up. So over on the west side of the state, in Everett Hospital, Swedish Hospital, these are two of the main ones involved. Things are getting very, very tight. Everett Hospital right now is full. They are having shortages of personal protective equipment like masks. And in my hospital, we are gearing up. So for the last 2 to 3 weeks, we've been in a planning process where we have been figuring out exactly what we can do to maximize our resources so we can take care of the largest number of people possible. And that's included things like canceling elective surgeries. How are we rationing our personal protective equipment so that when the deluge of coronavirus patients comes, that we're able to manage? How do we manage staffing when we have what we expect to be a record numbers of patients that exceed what the hospital was built for? How do we figure out who gets a ventilator, or how do we make sure we give as many people access to a ventilator as possible? How do we manage the fact that we have already large numbers of people who we suspect might have coronavirus, but we don't know because there's a huge testing delay? And how do we have a hospital continue to run smoothly when we have this really dreaded pandemic going on, and we have a lot of people we think might have it, and we don't know who those people really are? And so we are isolating a lot of people, but that's very disruptive to the flow of the hospital. So we've been working with a lot of these things and trying to use the time that we've got to plan, to ramp up so that as the tidal wave reaches us, we are going to be ready.
Yeah, this is such a new situation. I can't even comprehend how you could get ready for something when you have so much information just coming into the media sphere. Some of it's really good information, some of it's really bad information. What would you say are some important things that you're not hearing about this virus in the mainstream media, but people should know about?
Okay, so I think the number one thing that I would say that people really ought to know is how the virus is transmitted. Okay, so it's a droplet virus. So every time we talk, especially if we cough or we sneeze, but even if we talk or we breathe, all right, little droplets get pushed out of our mouth. Okay, the nice thing, though, about droplets is they don't aerosolize like all over the place and just stick around in the air. That's like measles, just sticks around in the air. But this is, we believe now, this is the most up-to-date information, and I believe it to be reliable, but take it with a grain of salt. Things are still new, and this is coming from centralized authorities who are continually revising what they say. But we believe that these are pretty heavy droplets, and that they probably drop out of the air within about 6 feet. And that's why you always hear, stay 6 feet away from other people, because probably you're not going to be able to contract the virus, probably, if you're 6 feet away from somebody who's breathing. The main modes of transmission are via surfaces. You touch a table, you touch a doorknob, and then you have to go a step further and you have to touch a mucous membrane. That's you touch your face, your eye, something like that. So the big thing, 6 feet away from other people, number one, and then number two is wash your hands, wash your hands, wash your hands, clean down the surfaces that you're using, and don't touch your face. Those are hard. That's hard to do, especially the don't touch your face part. But those are probably the biggest things that you can do to protect yourself. When we talk about social isolation or social distancing, as it were, what we're really trying to do is avoid people spreading the disease to each other. And one of the important things to realize is that it's on surfaces. So I am very, very cognizant right now of everything I touch. And I try to really avoid touching surfaces touched by other people. When I'm at the hospital at my desk, workspaces, I'm wiping them down with Cavi wipes, and I'm putting gloves on, and I'm not shaking hands. These are the kind of things that you can do to, I think, go a long way towards protecting yourself. Now, go ahead. Sorry.
Yeah, no. I was just going to say, humans are very interesting creatures. You tell them not to touch their face, they're going to try to touch their face automatically, and they freak out that way. But yeah. But go ahead.
So now, in the hospital, we have some unique concerns because you can do things to what we call aerosolize the virus. So if we're intubating someone, that's a procedure where we basically put them under anesthesia and we put a tube in their throat so we can hook them up to a ventilator. Or if we're using some certain advanced ways of delivering oxygen, we call it like high flow nasal cannula or vapotherm, or if we're using something called BiPAP, these are all capable of aerosolizing the virus. But if you're just at the supermarket, okay, just staying 6 feet away from people, probably going to help. But if you're going somewhere like a bar where there's 20 people lined up at the bar and everybody's got their glasses and they're touching the bar and they're touching their glasses, that's a real recipe for spread. So trying to kind of give you an idea of how you could rank the risks of different things you do during the day, and why it is that like crowded places are no good, and why is it that a lot of restaurants have said, like, we'll serve carry out, but we won't let you eat here. And that's because it's just a nightmare to clean all the surfaces that people touch all the time. But, I went through the Starbucks drive-thru this morning. Everybody in there had gloves on, and they're following protocols, trying to just sanitize every surface they can as much as possible. And nobody's actually going into Starbucks to sit down and drink. You have to go through the drive-thru. You can't even go in.
Yeah, this definitely seems like a very serious situation, and it's something that we've been taking serious here. I mean, I had people make fun of me in January when I was prepping. We were reporting about this, documenting this happening, but there's other people who don't believe it's as serious as people make it out to be. Donald Trump said that this is just the flu. There's people talking about 5G. There's people talking about QAnon and how this is all a ruse to arrest Oprah Winfrey and Tom Hanks and all this other crazy stuff. But for me, one of the theories that I heard out there that might be true is that there hasn't been really a good response from the government, and one reason is that one theory is out there, and I kind of wanted to run it by you and see what you think about this, is that there's a theory that there needs to be herd immunity to this virus, that if enough people quarantine, that this virus is still going to continue to spread, but if enough people get it, we'll somehow build immunity to this. Is there any truth of this, and could it be an excuse for the kind of bad response, the poor testing, the lack of equipment, and the kind of poor response that we've been seeing from all the states in the U.S.?
Yeah, I've heard that people make this claim, and there was talk about the idea that this is basically what the UK was going for in their coordinated response. And there are a couple of problems with it. And I would say the first problem with just kind of saying, let's sit back and let herd immunity take effect, is that we know with a lot of other coronaviruses, because keep in mind, COVID-19 is one of a virus, of a family of viruses that affects humans. We know with a lot of other coronaviruses that immunity isn't that long. You might be immune for 9 months or a year after getting it. And we haven't really got a good idea of how long you're going to have immunity for, or how strong that immunity is. We use the phrase, I'm immune, but that doesn't mean that 100% of the people who have gotten something won't get it again. I've seen people with viral diseases that thought they were immune that do get them again. And so we're way too early in this process to know what that is. So you're taking a big gamble on an unknown if you think you're going to stop the pandemic by just sitting back. And the second thing I would say is, and this is what I'm in agreement with just about everybody else in my profession and the media and everything that we're talking about. We want to flatten the curve. And here's what we mean by that. So, like, if we didn't take action, and I'm not talking about the government, I'm talking about as individuals and as a community, as our communities, if we didn't act to stop the spread of this virus, what would happen? Is we would have sequentially more and more, exponentially more and more infections until our healthcare system got overwhelmed, as we saw happen in Wuhan, as we saw and is still happening in Lombardy and Italy, as is about to happen in France and Spain, and is happening, just the tip of the iceberg happening in Seattle right now, right? And so what happens? Then you have a heart attack, but they can't help you for your heart attack. Then you have, a skin infection in your leg, but they can't help you with the skin infection in your leg. And they're trying to treat people, but it's just, there's too much. And then all of a sudden we say old people don't get care. And we start saying if you have medical comorbidities, you don't get care. And so what you see is all of a sudden the death rate goes way up, because now something as simple as providing some antibiotics, some oxygen, maybe a few days on a ventilator becomes impossible. And all those things that we treat so well, like, somebody has a ST segment elevation MI, and we're really good in most of the United States about getting that person into the cath lab, getting their heart attack treated right away, and that really helps mortality. Or you have a stroke, and we have, these well-oiled processes to get you clot-busting drugs within what we call the golden 90 minutes. All these things break down, and then the death rate just shoots through the roof. But if we spread it out, it's true the economic pain might be a little more, but if we spread it out and we keep it below that critical mass where everybody gets overwhelmed, then our essential things that we really know save lives in our healthcare system, whether you like the word system or not, but it's what it is, our healthcare system continues to function at the high level we want it to. And so that's where I have a big problem with the idea of saying, hey, let's just get this over with. It's not like a chickenpox party with kids. And the additional problem with that is that, the narrative is that only elderly people or only sick people are dying from this. And it's true that the majority are elderly and sick. But young, healthy people can die from this too. And they die in one of two ways. Number one, they develop ARDS. That's called acute respiratory distress syndrome. It's an inflammatory condition in the lungs. I've seen many, many young people die from viral respiratory illness this way, and it's heartbreaking because they don't have anything else wrong with them. And you think I should be able to save this person, and it's a really long, drawn-out process of them dying. It's resource-intensive. It's painful for them. It's painful for their families. It's horrible. It's traumatic for the doctors and nurses. And then the other way is that this virus, we are just starting to find out, is actually infecting people's hearts. And it's making them go into a viral cardiomyopathy or heart failure, and then they're dying of heart arrhythmias. That, yes, is happening more in older people, but that also can happen in younger people, and we're not immune. So if you let it just, explode, and you're not able to control it, you're going to see such large numbers of people get it that even large numbers of young people will die. And so that's, I think it's a really, really bad idea to think we should treat it like a chickenpox party. And for that matter, I think chickenpox parties are a bad idea. But it's not something that we can just laugh off or just shrug off. It's a real threat to each and every one of us. And I think that as responsible human beings who care about our communities, we should treat it that way. Sorry, go ahead. I was just saying, I'm really optimistic that within 12 to 18 months, we're going to have a functional vaccine. And if we can prevent, a few million people from getting the virus until there's a vaccine available, we've effectively prevented those infections from ever occurring. Additionally, if we can just delay cases a few weeks, we can do have a tremendous sea change, because testing right now, especially in the United States, is really restricted. It's the FDA and the CDC's fault. We decided, as our government decided, not we, that we would have a centralized system for disaster response. So when the CDC declared this an emergency, it basically meant that there were tons of flaming hoops for any private lab company to jump through to try to get a lab, so the labs didn't really try. And then the CDC botched the rollout of the test. And so we just got an update today that said that our tests we thought were going to get back in 3 to 4 days are going to take 7 to 10 days, because now even LabCorp and Quest, who are private companies running the labs, are just overwhelmed with the samples they've received. So if we are able to delay a lot of infections with really strong social distancing measures, then what we may see in 2 months is that finally we've gotten to the point where testing can be done rapidly and cheaply and on a really wide scale. Singapore has tests turning around in 3 hours right now. We are being stupid, not just saying to Singapore, hey, let us buy your tests, because they could ramp up production very fast, send them over here, and we'd be done. But at some point, this problem is going to be solved. And when it is, we can do a much better job controlling the virus by widespread testing and contact tracing. Contact tracing is where when somebody tests positive, you go to them and you say, okay, you tested positive. I need you to tell me who you've been in contact with over the last 7 or 14 days. And let's walk day by day through it. We figure those people out, and then we have workers who go and contact those people and say, hey, you've been exposed. Would you like to be tested? And in doing that, what we can then do is focus on is shift from just everybody distanced from everybody to we can find the people who have the asymptomatic infections and let them know so they can isolate themselves before they infect anybody else. And so we could see a major sea change where we get this under control with testing, but we have to have social isolation right now because the government is, sorry to use the word, screwed us out of the ability to test widely and with rapid turnaround.
Yep, and so to answer the original question, it looks like it's incompetency, especially with regulations, with big government, with bureaucracy, and also the CDC and Surgeon General contradicting themselves, the president and the vice president contradicting themselves. I mean, if we look at the successful cases, and I've been saying this, correct me if I'm wrong, doctor, if we look at the countries that have been handling this well, Singapore, the territory of Hong Kong, New Zealand, and Russia, they followed the pandemic protocol. The United States is not following that protocol. They're not hunkering down, and they're not testing aggressively. What is going on with these tests? Because, I mean, if we look at what's happening with the test, if you look at even the respirator companies that are coming out and saying, hey, there's no one even filling out orders. We could have a lot more respirators. We don't, because the government's sitting on their buttocks here. It almost seems like the government's making it worse, from my perspective. How do you see it? Am I wrong for saying that?
Oh, the government is absolutely making this 10 times worse than it has to be. There would not be a need for a national shutdown if we didn't have the government interfering with our ability to address this. So here's the thing. Whenever you have a system that has a central point of failure, you put yourself at really high risk. And whenever something is decentralized or distributed, the really great thing is that when one thing doesn't work, the other nodes of the system can pick up the slack. But what we did in the United States is we decided we would have a central point of failure because we would just invest these CDC and FDA bureaucrats with so much power. We also have a really strong tradition of heavy regulation in the medical sector. And so we created this central point of failure, and we just created so many onerous regulations. So to give you an example, when private companies wanted to first start testing the kit, start developing testing. They developed tests, and then the FDA said, well, you can't use this test until you prove to us that this will not deliver a false positive if someone is infected with SARS or MERS, which are very, very genetically similar viruses. And I have two responses to that. Number one, these companies couldn't get the samples of the SARS and the MERS they needed to prove that. So they were literally given an impossible task by the FDA, which is a bureaucrat's way of saying, sorry, no, we don't want you intruding on our turf, because people get very parochial in government and bureaucracies where this is my area, my domain, and I don't want anybody doing things over here. I trained at a military hospital. That was one of the things I noticed, that every kind of command got very parochial over their particular area. There was the IT the people, and there was this, and it was very political. And I think that's what happened, is that the FDA gave the private companies this impossible task to get an approval as essentially a way to keep them from competing with the CDC's tests. But it gets worse than that, because other countries develop tests that are really fast and cheap, and then we can't buy them. And what's really dear to my heart right now is personal protective equipment. I'm talking about N95 masks, gowns, gloves, eye shields. This stuff could literally save my life, and we're rationing it right now. And we're doing a lot of things. We have to, because we don't, we have to make sure that we protect our supply, but we don't have it. Why? Well, the supply chains broke down. They broke down because every other country that makes this stuff is having a pandemic, and they said, well, we're having this pandemic too. We're not exporting right now. and their factories shut. Like in China, the factories shut that were making it. But here's the thing. It's not hard to make masks, gloves, and gowns. Pretty much anybody who makes paper products or anything like that could do it. But you have to get FDA clearance to market this. So I was in a discussion group with doctors today who actually had gone out and found some Chinese manufacturers that were going to be, and some freight forwarders and all this stuff. And they were like, we're going to import our own stuff. And then people started talking. They're like, wait a minute, it won't get past customs because it's not FDA cleared. So the FDA, by their overregulation, they said, we're going to protect you. Well, you're not protecting me if you keep me from getting supplies to keep myself safe. And that's a huge problem. So it's our addiction to regulation, where we think that if we just give the government the power to just make sure that we're safe in every which way, and we don't take any personal responsibility, well, at the end of the day, that comes around and bites us. And we're seeing how badly that bites us right now.
Yeah. Wow. Thank you so much for that information. I had no idea about, some of the stuff that you presented here. I knew the government was just sitting on their butt, and there was so much red tape, and there's so much just standing in the way from actually doing the right thing here and having the right resources, because this is serious. And this is real good information coming from you. I know you consider yourself kind of like a libertarian activist. You spoke at Anarchapulco. So this is something important to you that I hope gets out there to the larger public so people take this seriously, because as I've been saying, if the people don't take this seriously, the government will have to step in, and then their more bureaucracy, their more incompetence will have, the worse the situation will get. So again, we all need to take personal responsibility. Are there any other tips you would give people other than social distancing? I mean, there's a bunch of people who have this, don't even know it. I'm hearing online that, stuff like supplementing elderberry is bad for you, actually. I'm hearing Tylenol is actually bad for this. Are you hearing any of those correlations? Are there any things that people could take who are sick? I know 4 people who have symptoms. They can't get tested. They're in New York City right now. It's just mind-boggling. Do you have any tips and advice other than watching meditation calming videos so people could catch their breath? What advice do you give to people who can't get tested, who are showing symptoms right now? What can they do?
All right. Well, first of all, let me preface everything I'm about to say by saying it's based on preliminary data. Okay, there is no standard of care yet developed for coronavirus. There are no double-blind, placebo-controlled trials that give us high-quality evidence. So what I'm going to tell you is based on everything I've been reading, stuff coming out of Italy, stuff coming out of China, and I could be wrong. And if you do anything that I mention here, you have to realize that there's a strong chance that this could just be completely wrong. And my recommendation to you would be do your own reading, because if you're watching this podcast, you're smart enough to go on Google, type in whatever you're searching for, find PubMed. PubMed is the resource, right, where peer-reviewed journals can be searched, and you can search that, and you can look at the case reports, and you can understand the quality of evidence that these things are based on. So what I'm giving you are leads about stuff you can do research on and make your own decision on. I'm not giving you advice. How can I give you advice when I'm not anybody out there having symptoms I don't know? Okay, first thing, there's a strong possibility that ibuprofen and other non-steroidal anti-inflammatory drugs may worsen the COVID-19 infection. So ibuprofen, we're talking about ibuprofen, we're talking about Toradol, we're talking about Celebrex, all of these things that fall into the class of non-steroidal anti-inflammatory drugs. The thought is that they might upregulate some of the receptors in your lungs that the virus uses to enter, and thereby kind of worsen the infection. All the doctors are talking right now, hey, don't use this class of drugs in coronavirus patients. Do we know it worsens the infection? Absolutely not. Are there big deal recommendations out there? Today I heard a rumor that the WHO released a recommendation against it, but I couldn't actually find the text from the WHO. So I'll find out in a day or two probably whether that's true. But I certainly wouldn't be giving a non-steroidal anti-inflammatory drug. Now, Tylenol is not a non-steroidal anti-inflammatory drug. So drugs like ibuprofen, naproxen, those kind of non-steroidals, those drugs are often used to treat fevers, and they're often used to treat pain. And with people with a typical cold, they love to take those drugs. And it works, right? It brings your fever down, you feel better, great. But if it could worsen the COVID-19 infection, you shouldn't use it if you could have a COVID-19 infection. So Tylenol, on the other hand, is not part of that class. It can reduce a fever, and I have no evidence and know of no evidence that Tylenol could worsen the infection. Tylenol seems to me to be okay. Second set of drugs that I would consider, if I had high blood pressure or another medical problem that led to me taking an ACE inhibitor, and this is a blood pressure medication. ACE inhibitor, angiotensin converting enzyme. That's the class of drugs, and that's like lisinopril, captopril, ramipril, enalapril. They all end in pril, and they're usually blood pressure medications, although they're also given to diabetics who have kidney issues, or they're given to heart failure patients. If I were on one of these medications, I would switch to an angiotensin receptor blocker. It's a very similar medication, but there's a lot of speculation, and there are some papers coming out of China now that are, and I think one out of Italy, that are discussing the possibility that ACE inhibitors could upregulate the same receptors that we're worried about with the NSAID class of drugs. So again, very preliminary, but if it was me, I would switch. That's because the angiotensin receptor blockers work for every indication that an ACE inhibitor works for. So there's no like benefit to taking an ACE inhibitor over an angiotensin receptor blocker. They're all cheap generic drugs, and they're pretty interchangeable. I mean, you would have to talk to your doctor about the dosing, and you probably have to like monitor your blood pressure over the course of the change and stuff like that. But I would say it's worth talking to your doctor about it. And I've advised my family to talk to their doctors about making that switch. If I were taking that medication, I would switch myself. Okay. No.
Yeah. Go ahead.
Okay. Number 3 is chloroquine, and this is an anti-malarial drug. And then there's another drug really commonly used in the United States for conditions called lupus, called hydroxychloroquine. Okay. There is a lot of talk about these medications being able to change the environment inside your cells so that the virus can't thrive. And there are preliminary studies that are not high quality in terms of placebo-controlled, double-blind, or anything like that, but that are kind of comparing groups that show that people have milder illness, fewer complications, and quicker resolution of their illness when they're taking chloroquine or hydroxychloroquine. Hydroxychloroquine is sold in the US under the brand name Plaquenil. This would be an off-label use of the drug, but I feel convinced enough by what I have read that if I were to get a COVID-19 infection, I would start taking Plaquenil, hydroxychloroquine. That doesn't mean that I would tell anybody else to. I would tell you have to read about it and make your own decision, because Plaquenil can also have side effects. It's an immune suppressant, actually. And so it's not like it's a risk-free decision. I would talk to your doctor about it. Now, I'm a hospitalist, which means I practice inpatient medicine. So COVID-19 patients, actually, every hospital right now, we kind of set up this hierarchy where we say the infectious disease specialists are going to be in charge of the therapeutic part of this. At least for now. As we get more patients, that may change. But at least for now, what that means is that these guys who are specialists in infectious diseases and viruses and this kind of thing have spent a lot of time reading this data, and they also know about all the clinical trials available, because there are other drugs in the hospital that we might use, one called Remdesivir, that is made by Gilead that's really promising, right? So there are a few others. Right. And so they're going to be in charge of making decisions about that. So I won't have to make those decisions. But if I were seeing you in my clinic and you had COVID-19, I would prescribe Plaquenil. We would have a long conversation about the benefits and risks, about the fact that it's an off-label prescription, and about the fact that it could actually hurt you and not help you. But that my assessment of what we know right now is that it may very well help you. Some things I wouldn't do. I would not take super high doses of vitamin C. Reason being is that there's a lot of talk right now, and a couple of things published that talk about how vitamin C might actually cause a cytokine storm to be more likely. And what a cytokine storm is kind of the immune system event that causes ARDS, which I talked about earlier, acute respiratory distress syndrome. So I wouldn't take hyperdoses of vitamin C. What would I tell healthy people who are practicing social distancing? Very simple. I would say that you should focus on leading your day-to-day life in a healthy way. Don't smoke, don't drink, don't do drugs, don't eat processed foods. Try to get a little exercise every day. Try to get sufficient amounts of sleep. All those things that just go into being a healthy person, because the healthier you are, the more likely you are to survive if something does happen to you. So those would be the thing. And then obviously try not to get infected. Those would be the things I would tell people who are healthy. And I want to just preface everything I just said. These are thoughts about what I've read and what I might do, but I don't know your situation, so I can't possibly tell you what to do. That's for you and your doctor to figure out. But this is a place where you could start doing some research.
Thank you so much for that detailed information, and of course the disclaimer: every human body is different and reacts to different substances differently. There's not a supplement or a medicine or a vitamin that works universally on all people. There's people allergic to water, so there can't be any direct kind of stuff put it out there, especially with how new and how developing this still is. Now, some of the things I wanted to ask you, Doctor, is, thank you for all this detailed information, because there's a lot of people anxiously waiting. There's a lot of hypochondriacs. Myself, I'm having shortness of breath, and I'm like starting to panic and like freak out. I'm like, what's going on? I turned on a meditation app. I'm like, breathing might be an anxiety attack, but people automatically think of the worst situation. I'm usually an optimist, but I'll tell you why I'm not optimistic about this situation. And you said you are, so this is what I really would want to know. I'm not an optimist because I see some people not taking this seriously, and I see government standing in the way. How do you see this unfolding? Because with those two factors, I kind of lost some of my optimism, to be honest.
Okay, so here's what I think. We have started basically a nationwide near lockdown, and I think it's going to have an effect. And it'll have an effect that lags somewhere between 10 and 14 days. So what I expect to see is that our cases and our deaths will continue, our new cases, to go up, and we'll have more every day. And if you want to look at the data, worldometers.info is the best site. These guys have just aggregated all the data from every country they can, and they make graphs and charts and everything. You can see just the raw numbers, and then you can draw your own conclusions. But what we're seeing right now in the United States is every day we have 10 to 20% more cases than the day before. Exponential growth. And every day 10 to 20% more deaths than the day before. That's going to continue probably for 10 to 14 days. And then we're going to start seeing new cases drop and deaths drop. And my hope is that within the next 14 days, we're going to see massive expansion of testing capability, because what I think we are seeing from the Trump administration, and I'm no fan of theirs, but what we are seeing is that there is a willingness to slash regulations. And so, like, if anybody from the Trump administration is listening, the most important thing you can do is slash regulations. There's nothing more powerful than deleting pieces of the federal code. And you can say it's temporary right now and they just never reenact it. That's fine. But they've started to realize this, and they're making exceptions, and the FDA is moving very fast. I told you I'm optimistic that there's a vaccine that's going to happen within 12 to 18 months. And that's because basically the FDA's got a fire in their belly to green light everything they can in terms of trials, and it's eventually going to be approvals for a COVID-19 vaccine. I believe last I checked, there are 12 vaccine candidates that are going through the process. That gives me a lot of hope. Because 12 separate companies with 12 slightly different ideas about how to accomplish this are all going full speed ahead. I suspect several of them are going to meet their clinical trial endpoints. And then we're going to figure out, hopefully in a marketplace fashion, which vaccine or which combination of vaccines is preferable. And so I'm excited about that. Now, that's a little bit of a ways off, but I mean, it's unheard of in human history for something to go from concept to market in 12 to 18 months. And what I really hope is that we can see this happen, and then the American people can demand that every disease be treated as an emergency like COVID-19, and that we let drug companies move as fast as they can to develop new therapies so that we can leave COVID-19 in the dustbin of history, and then we can start leaving other diseases in the dustbin of history. That's something I'm really really excited about. But I'm also optimistic because we have an amazing private sector in the United States. And and as I mentioned, deregulation is happening rapidly and I think is going to continue to happen. But our salvation lies in the private sector. It lies in people seeking to profit by fixing problems. And so what we've seen now, there's a group of do-it-yourselfers. This is really cool. These are do-it-yourselfer biohacker kind of guys. They've got 3D printers, and they figured out a valve that they can create to actually make it so one ventilator can ventilate 4 patients. That won't quadruple our capacity, but it will massively expand our capacity. And in the current crisis, we'll be able to just take their valve and use it if we need to save lives. I think that the attitude right now is, if you need to do something to save lives, do it. And so, ordinarily that would take, years of medical device approvals, but we'll just say, put that on your 3D printer and hand it over. And we'll just use it. And you can't use it for every patient because there are some advanced ventilator modes that some of these patients might need, but there will be a lot of people who will be able to manage 4 to events. So if we get in a crunch, we can expand that way. There are other do-it-yourselfers who are creating a mechanical device to squeeze an ambu bag. An ambu bag is like a little bag that you can use to ventilate someone with a tube. And they're creating a mechanical device that'll squeeze the ambu bag. They're doing this in Ireland. And with that, plus something we call a PEEP valve, what you've got is a functioning mechanical ventilator, and they're making it with 3D printers, and it'll probably cost like a couple $100 to put together. And all of a sudden, they can just roll these off the assembly line, and we can have these rudimentary ventilators. They're not going to be as good, and they're not going to be able to do the advanced ventilation modes you need for people with severe ARDS, but they can take care of 80% of our cases. And so what's that going to do? When the coronavirus epidemic ends, that doesn't mean those devices go away. A $200 or $300 ventilator could be used in sub-Saharan Africa at places where they have a constant shortage of ventilators, or in Venezuela, where the narco dictatorship has completely destroyed all the healthcare, and getting a ventilator is next to impossible. But when you have a $200 piece of equipment that can hold in somebody's hands, all of a sudden, what you're seeing is the free market bringing advanced healthcare to people who never would have gotten it before. That's exciting.
Yep,
it's really exciting.
And it's important to note here, the ventilator companies have gone public and said we could ramp up production. We could have a whole bunch of these things ready for everyone, available for as many people as possible. And they're not getting any orders in right now. Luckily, they're publicly speaking out. Hopefully that changes soon. The volunteers who 3D printed the medical devices for about $1, they're also being sued for intellectual copy infringement claim right now. So that's also happening there. I mean, to me, this is a very, very crazy situation. There should be all hands on deck, and I think we should be doing everything we can to stop it. One last thing, because I know there's going to be a lot of people who are critical of vaccines. There's also some data I saw coming from China showing that 17% of people got the virus again after having it the first time, which some people say suggests that the vaccine might not work. What would you say to people who are critical of like vaccines? Because there's going to be a lot of those individuals.
Yeah, there are a lot of individuals like that, and I tend not to argue with them because reason is lost on people like that. And so my reaction is, you do you. If you don't want a vaccine, I think that's a really bad idea. But having argued and argued and argued, I've realized that I can't hit my head up against a wall anymore, so I don't argue. Vaccination ultimately should be voluntary, and it's just an odious idea that the government should force anybody to receive a vaccination. But as a matter of my personal preferences, I am vaccinated against everything except Japanese encephalitis. And the only reason I'm not vaccinated against Japanese encephalitis is because I haven't been to rural parts of Asia. There's strong evidence that vaccination is highly protective. Yeah, you're right. Some people are getting reinfected, and I told you earlier that that other coronavirus infections are only conferring 9 to 12 months of immunity. But the benefit of a vaccine, or the good thing about a vaccine when you're developing it, is that you can design a vaccine to produce specific antibodies. And so what you find in somebody is that, you say you get infected with a virus, is not one antibody that your body produces, right? Your body doesn't have the ability to like look at a virus and just figure out what will kill it. Your body basically uses a shotgun approach. It creates antibody after antibody after antibody. And then basically it sees which one works and then ramps up the production of that one. But sometimes you don't create, and we call those neutralizing antibodies, right? And so the key is really to find the antibody, which is really, it's a protein, right? And it's in a particular shape that binds to the virus in the right way. So the key is find that neutralizing antibody and then set it off against that. In principle, there's no reason they shouldn't be able to do that for COVID-19 and for SARS and for MERS and for the other coronaviruses that cause common colds, which there are 4 really common ones, and then there are like a bunch of other less common ones. But in principle, there's no reason that a neutralizing antibody shouldn't be discovered. So it's not like vaccines, right, are not just so simple as saying, I'm going to kill this virus and then inject it into you. That's how they used to be done, and a few are still done that way. But moving forward in vaccine development, people are trying a lot of new techniques, trying to figure out how to get the body to produce the right antibodies. And they're using a lot of data science and molecular genomics, all this stuff I barely understand when I read the papers about it. But they're using all of this stuff to try to get higher quality vaccines. You know, they've been struggling for the better part of 20 years to produce a dengue fever vaccine, and it looks like they finally got one that's about 80 to 90% effective in clinical trials. We just got that news like 2 days ago. And so there are new techniques. So what I'm trying to say is that I think there's a really good chance that one of these 12 vaccine candidates is going to pan out. And then we have to look at the data presented by the manufacturers, and we have to make individual informed decisions. And if you don't want to take it, that's fine. I mean, it's wrong to force somebody to take it. But I have to say that I have a really low opinion of the anti-vax community because I think that they do things like abuse statistics and misuse statistics, or don't understand statistics and don't understand cause and effect and mistake causation for correlation. And at the end of the day, I don't even find it worth arguing with them.
Yeah, I know there's usually huge arguments and fights online. I am not a vaccine expert. It's not in my issue. I am not a doctor. I am not a medical professional. And all I could always, say with certainty is that every human body, every human biology, every human brain chemistry is different than somebody else. So again, I always say, do your own homework, do your own research. Don't believe me. Don't believe anyone. It's up to you to take individual responsibility for yourself. And doctor, thank you so much for this download of information. I was hoping to go for 10 minutes. We went far longer than 10 minutes, and I'm happy we did to get your side of the perspective from everything that's happening, from what you're seeing on the front lines and all the research and work you've done throughout hospitals all across the United States. Your website is drvarner.com. We're going to have it linked in the description below so people could find you and find more of your work. You're, again, libertarian activist, spoken anarcho-poco. Very, very important information. Share this video because YouTube, of course, will make sure that it's downranked and punished. But this is actual information that we're getting. Doctor, is there anything else we should know? Anything else you want to leave us with? Anything else you want to share, maybe about yourself or your work, or just about this topic in general?
Well, I would just tell everybody who's watching right now that we're in a crisis situation all over the world, and it can seem like the world is burning. And whenever that happens, I spend a lot of time working in crisis situations. And there's this prayer. I'm an atheist, but there's this prayer that I always repeat to myself, which is, Lord, give me the courage to change the things I can, the serenity to accept the things I can't, and the wisdom to know the difference. And I repeat that to myself several times a day right now. And what each and every one of us needs to do is move forward, putting one foot in front of the other, always doing the right thing. And I am really confident that when we emerge from this, that the world is going to rise like a phoenix from the ashes, and we're going to have new technologies, new ways of doing things. Old paradigms are going to be broken. And the future is something that I am so excited for. The future is libertarian, and I can't wait to see it.
I surely hope so. And when we come out the other end of it, there's definitely going to be a lot of people humbled, a lot of people just respecting and loving and living life to the fullest. And Doctor, thank you so much for your perspective. Thank you so much for your time. I really, really appreciate it. I know you're tired. I know you're working a lot. drvarner.com. The link will be in the description below so people can find it. Any other way we could help you, just let us know. Thank you sincerely for joining us, and I hope you guys enjoy that. Seriously, share this video with your friends and family members. If you don't, YouTube definitely won't either. Stay tuned for more here on wearechange.org.